Hello. Welcome everyone to the 14th Annual International Ependymoma Awareness Day. My name is Kim Walgren, and I am the Executive Director of the CERN program at the National Brain Tumor Society. I am so honored to share this day with all of you. Ependymoma Awareness Day was created in 2012 and brings attention to the rare cancer and unique challenges faced by ependymoma patients, survivors, care partners, researchers, and medical providers. Our goal with Ependymoma Awareness Day is to increase public and professional recognition of this rare tumor, to shine a light on the unique challenges faced by this community, and express the urgent need to develop better targeted treatments and clinical trials to improve the quality of life and ultimately to find a cure for those living with this disease. As many of you know, on Ependymoma Awareness Day, people around the world participate in various ways, including butterfly-themed activities to honor loved ones with ependymoma and recognize care partners and medical workers. The delicate and beautiful butterfly was chosen to represent the spirit of the ependymoma community as a symbol of hope through change. Just as a butterfly dramatically changes its shape, so can the meaning of hope along this journey. I'm amazed at the representation of community members just here today on this webinar. Over 250 of you from around the world, countries like Austria, Australia, Israel, Germany, Jordan, South Africa, Sweden, Canada, Mexico, New Zealand, Ireland, and across the US have registered and are participating today. And not just geographical representation. We have a wide variety of supporters, including survivors, parents, siblings, neighbors, friends, researchers, and clinicians with a connection to pediatric, young adult disease in the brain and in the spine. This speaks to the many different types of experiences people have with ependymoma. There is great strength in the diversity and raising awareness together about the urgent need for more treatments for ependymoma is key. During the 60-minute webinar, we will hear from patient families, expert speakers, take community polls, announce a new service award, and conclude by watching Emily Meyer's video and butterfly release. In addition to raising awareness and communicating our urgent need for treatment for ependymoma, an additional goal of today's webinar is to inspire and to empower, serving as a reminder that having a rare disease does not mean that you are alone. All the content shared today is informational and is not considered medical advice. We hope you will be active in the chat and encourage and support each other. Feel free to share now where you are tuning in from and your connection to ependymoma. Finally, I know this day holds different meaning for everyone. We want this to be a welcoming space for all of you, no matter where you are at in your experience with an ependymoma diagnosis, survivorship, and or grief process. Whether you are newly diagnosed, dealing with a child's recurrence, celebrating survivorship, navigating a recurrence, or processing the loss of a loved one, or a researcher working tirelessly to help people with ependymoma despite many barriers to research. You are welcome here. This day is for you. This webinar will be recorded and everyone will receive a copy and a follow-up email along with other important engagement opportunities. At this time, I would like to introduce you to the first community speakers, Mike and Megan Patterson, to share their personal experience with Megan's ependymoma diagnosis, which occurred during the pandemic. Dr. Megan Jones Patterson and her husband Mike live in Boulder, Colorado with their two cats, Churro and Crouton. They are avid naturalists, birders, and travelers. Mike and Megan, at this time, you are welcome to begin sharing your story.
Hello and welcome, and thank you all for visiting today. Before I kind of start, I want to say that while I am very comfortable sharing my story, I often get a bit emotional at certain points. So please don't feel too bad if I cry or have my voice break at some point. Yeah. So as a trained research scientist and educator, I typically take curiosity into new situations, but I'm also a bit stubborn. And so I was very slow to seek answers to my pain that was increasing in fits and starts and spurts since the fall of 2018. So it wasn't until January of 2020 when I finally saw the first of several doctors to figure out what was going on. After lockdown in late April 2020, I had my first MRI and we discovered that I had a tumor in my spinal column at the fourth, fifth lumbar level. So now what? This was the start of trying to make sense out of all the information, often by seeking second opinions. Who to do my surgery? The back specialist I was seeing suggested some orthopedic surgeons. A family member working in the medical field close to where I lived suggested other names and other facilities. This was in my spinal cord, and I like having full function of my nerves and muscles, so I wanted to also consider a neurosurgeon. I looked for surgeons covered by my insurance that were in my local area, and a friend recommended a neurosurgeon of her own. I set up appointments, some in person, some virtual. It was a comfort to hear that they all had similar recommendations and plans for how they would treat me. All thought that it was a benign schwannoma based on the images. But of course, they included a long compendium of other possibilities as well. In the end, I ended up choosing my surgeon based on location and the rapport that I had with the individual. A few days post-surgery, we got the biopsy results. And based on me being here today, you know that it was not a schwannoma. It was ependymoma, a cancer. Mike is going to talk more about our quest to find out cancer care, as he is really the one who took the lead as I was in surgery recovery. But before I hand it over to Mike, I want to talk a little bit more about the importance of getting second opinions outside of and after treatment as well. For us, there was not only the decision of where to get the cancer treatment, but auxiliary questions like family planning, cognitive changes that would impact my career, and much more. Going to a larger facility like MD Anderson, where I eventually chose to get treatment, meant that I had access to specialists in fertility, cognition, and some of the other side concerns that we had. It was really important that we were able to talk to these individuals to help us make some of these life-changing decisions. While some may consider this next part to be more support network and not a true second opinion, I would encourage all survivors and caregivers to find a community to get other opinions from after their treatment as well. It's not just looking for those second opinions on the treatment itself. There's a wide variety of support groups out there. For me, I found First Descents, which allowed me to combine my passion and need for the outdoor adventure with a community who understood what they were going through, what I was going through because of their own cancer treatment and post-treatment journeys. 5 years following on from my diagnosis, I'm still seeking second opinions from them on how to navigate rough days, odd situations that come about because of what we've gone through, and so much more. So I just really encourage everyone to think about, all those options at the different parts of wherever you are at, and to find those other second opinions throughout that whole thing. And now I'll turn it over to Mike.
Thanks, man. As a caregiver, my story directly interacting with cancer and ependymoma started Wednesday, June 10th, 2020, exactly 5 years ago. Day 5 of 8 of Megan's recovery in the ICU. Has anyone talked to you about your wife's biopsy results yet? The first lesson I learned was that no one needs approvals for good news, but bad news needs to wait. I'm sure many of you here have probably had a similar experience. In our case, the biopsy results were for anaplastic ependymoma, WHO grade 3, showing high amplification levels of mycin. As you can gather, we had absolutely no idea what the disease was, what that meant, or what to do. The second lesson I learned was that you cannot expect anyone to know everything, and you shouldn't. It's why you should expand your care team, your support network, and find as many second or third opinions as you can from trusted voices. Thankfully, the local neurosurgeon who was working with Megan was an incredible doctor and an incredible person. He didn't pretend he knew all the answers. He took our case to his tumor board to get a larger group's experience and knowledge. And to their credit, they were pretty spot on. Get better tests done with an MRI, and the next step could be treatment in a local area, but most likely we would need to leave the state for the best care. We were extra fortunate that our neurosurgeon had done a rotation at MD Anderson and knew them well, so he helped ensure that we had a good handoff. We had a good plan in place. But also, as a caretaker, during that entire time, I was desperate to feel some level of control. It was the height of the COVID epidemic. My wife had just been diagnosed with a cancer that pretty much was only ever described as incredibly rare. And also, I don't ever recommend trying to find prognosis stats for rare cancers on the internet if you value your mental state. It was a lot. So I dug into looking up medical research articles. And that led me to this group called the Collaborative Ependymoma Research Network. So while we were waiting for the board to convene, I reached out via the CERN portal, and within the day, I had Kim Walgren answering our questions. It's funny how memory in times of stress can have you focus on certain things over others. But Kim recommended similar hospitals, similar next steps, gave us questions to ask and things to think about. But what I remember most was the sudden and clear shift in my feelings of confidence after our conversation. For days and weeks, I've been running scared and unsure. Yes, our doctor was doing his best, and yes, the board was going to give us their best opinions. But the only thing that you ever hear about a disease is that it's rare, and when you hear that, it's hard to put a lot of stock into the game plan that comes next. CERN and Kim changed that framework. Sure, anaplastic ependymoma is rare, but they were very familiar with it. And not only that, but here are the hospitals and people to talk to that also know how to treat it. No one needs to know everything when you can tap into a network that is focused on your disease. And with multiple sets of independent, well-informed physicians giving us generally overlapping advice, I was able to start feeling confident. A second or third opinion doesn't always have to be a different course of action, but instead can just be confirming that you're doing the best you can. For me, for us, that was the thing that I remember most of all, the feeling of safety, knowing we're doing the best we could. And I'll look back on it for the weeks from June 10th until July 16th when we spoke with Kim on the phone. It's like I've been getting tossed around by the waves at the beach, only to all of a sudden put my feet down and realize there was a bottom I could stand on. And just days later, we had our appointment set in Houston at MD Anderson Cancer Center. We weren't out of the woods yet, but knowing we were heading in the right direction was literally all the strength I needed to make sure that we'd get through it. And with that, thank you very much for hearing our journey. We'll be going off camera now, but I look forward to interacting with everyone. We forward to interacting with everyone on the chat. And thank you for joining and thank you for listening. Take care.
Thank you, Mike and Megan, so much for sharing your personal experience. And I know that's not easy to do. I know your story resonates with so many people in this community. So thank you. And thank you for your willingness to continue the conversation in the chat. At this time, I would like to introduce our expert speaker, Dr. Haji Panayas, a neurosurgeon at the University of Pittsburgh Medical Center, to talk about the importance of a second opinion for ependymoma and other rare types of spine tumors, and key questions to ask your provider. Dr. Haji Panayas is an executive vice chair for the University of Pittsburgh Neurological Surgery, director of the UPMC Center for Image-Guided Neurosurgery, and serves as co-director of the department's brain tumor program. He is the current chair of the AANS CNS tumor section, leading the largest group of neurosurgical oncologists in the world. He has focused much of his career on innovation, translational research, and intraoperative technology development. Thank you so much for joining us today. At this time, I will turn it over to you.
Thank you, Kim. Welcome, everyone. Honored to be part of this group. And Mike and Megan, thank you for sharing your story and your journey. I know it's difficult, but it's also probably feels good to share it with the group. And these diagnoses were the diagnosis we're talking about. In addition to all brain tumor diagnoses, is that they're difficult ones, and They carry a lot of weight, a lot of information that at first you have no idea about. And you step into this kind of tornado of activity, and you're given so many different pieces of information that you're trying to piece it all together. And that's where we come into play, and your providers, your medical experts that you trust are really there to help you along this journey. It's a difficult one, but it's a journey that can be done and can be done well. And I think these types of discussions are so important. So when it comes down to second opinions, what my feeling is, you should definitely get a second opinion. If you feel like you should get a third opinion, please do that. And in fact, I tell my patients, any provider who is uncomfortable with you getting a second opinion, you shouldn't be seeing that person, because second opinions really reinforce what me as a provider is instructing or informing my patient and their family. And it helps them understand the journey they're about to go on much better and feel more comfortable about it. Um, we talk about kind of expert centers of excellence in other areas that patients would like to go to get the best opinion. And I would say that you want to be seeking care from a place that's multidisciplinary. In other words, while there are neurosurgeons in different cities and hospitals, being part of a team that takes care of brain and spinal tumors is so important. And I think having the neurosurgeon talk to the radiation oncologist, talk to the neuro-oncologist, the neuroradiologist, the neuropathologist, working as a team is really important. And many of the brain tumor centers and programs do that. So I think that's important in your journey in terms of, finding another opinion to discuss what to do. Our job is really as surgeons to keep you or make you better without hurting you during surgery, but also take out as much of the tumor. And I think that's so important with ependymoma, is the extent of resection and having the right expertise with surgeons, having the right tools to do that type of surgery is important. So, I know it's daunting, and when you first see that first neurosurgeon, make sure that you talk about the experience they've had doing this, the team members around them. And again, the second opinion is so important. And a lot of people go to bigger academic medical centers, which is fine. I mean, you could do that. I know Mike and Megan, you guys went to MD Anderson, great institution, and I think that's really important to help with understanding how to proceed forward. In terms of testing, one of the things Kim had asked me to discuss, imaging for any type of brain tumor is so important. Understanding the extent of the tumor, involvement in the brain, the tracks around the brain or the spinal cord with ependymomas is so important, so that we can understand how to take out the tumor safely and again preserve neurologic function. So the imaging is very important. We also have to get imaging of sometimes the brain and the spine in certain cases with ependymoma. So that's something that we are intimately involved as the neurosurgical oncologist. After surgery, there's a bunch of things that happen in terms of testing of the tumor. We look at markers, different things that we now understand how the tumor can behave and respond to treatments. And I think that's something that we're in a new era with now, that patients are learning more and more about some of the research that we're doing and some of the predictive markers that we can actually look at in certain tumors. So that's also very important after the surgery is done. Um, some other caveats, when you go to surgery, we want to make sure that the team in the OR has the expertise for the surgery. We do monitoring in the operating room so we can make sure that your neurologic function is preserved during the surgery. So that's something that, you may want to ask your neurosurgeon, if they have that type of intraoperative neuromonitoring that's important, especially for spinal cord tumors. I think that's a key point that you may want to clarify with your providers and with brain tumors as well. So I think those are some of the highlights I wanted to provide. I know our time is precious here. I don't want to, take over the panel here, but those are some of the things that I would just keep in the back of my mind. And what I tell my patients, don't be afraid to get a second or third opinion. Very normal. In fact, again, your neurosurgeon should be okay with that and pleased that you're just getting some outside opinions to confirm what they're about to propose to you.
Thank you so much, Dr. Hadjipanayas, for that information and thoughtful presentation. I know that that will definitely help people navigate their care, and appreciate your time. At this time, we want to ask all of you about your experience with second opinions through an optional Zoom poll. You will be prompted to answer the following question, and we'll have a little bit of time to respond. Have you or your loved one ever received a second opinion at any point for your ependymoma diagnosis? Please answer yes or no or unsure, and submit. We have a couple more seconds and we can share the results here. It looks like a majority of you have, with 32% not having a second opinion and some who are unsure. So thank you for that. We will share these results in a follow-up email, and there's not a right or wrong answer. It's just something for us to be aware of in our community. And we'll have one more poll for all of you to participate in after the next segment. So at this point, I would like to introduce my colleague, Jenna Tazi, to give some brief remarks about National Brain Tumor Society's public health campaign called My Tumor ID.
Thank you so much, Kim. National Brain Tumor Society believes that every person living with a brain or spinal tumor deserves personalized care and the ability to make informed decisions about their treatment. That is why we launched the My Tumor ID public health campaign, a campaign aimed at highlighting the importance of biomarker testing and clinical trials. As we know, brain tumors are complex, and biomarker testing is key to understanding the molecular makeup of a brain tumor, which can provide critical information about an individual's diagnosis, prognosis, and treatment options. Ependymoma is a perfect example of this complexity. Some tumors may look the same under a microscope, but behave very differently depending on their molecular subtype. Biomarker testing can also open doors to innovative treatment options by determining clinical trial eligibility or access to approved targeted therapies. We know that clinical trial enrollment remains slow, but clinical trials help advance brain tumor research and provide patients with hope. This is especially important for rare tumor types like ependymoma, where clinical trials may be an avenue to treatment options beyond surgery or radiation. A survey we conducted in 2023 revealed that many patients and care partners still lack a clear understanding of these two subject areas. Around 31% of patients reported having at least a minimal understanding of what biomarker testing was. Around 61% of patients said their doctor did not discuss clinical trials as a treatment option. And around 84% of patients reported never having been enrolled in a clinical trial. This is exactly why we launched the My Tumor ID public health campaign. This educational initiative is designed to empower patients to ID their tumor's biomarkers, ID their treatment options, and make informed decisions about their care. Additionally, this campaign is engaging providers, payers, and policymakers to remove barriers and ensure that biomarker testing becomes a standard part of every brain tumor diagnosis. We encourage you to go on the mytumorid.org website and sign up to stay informed about new educational materials, videos, and upcoming webinars. Now I would like to introduce our second patient speaker, Daniel Godsill, to talk about his daughter and their experience understanding and processing her ependymoma diagnosis. Daniel Godsill is a composer, conductor, and music professor at Columbia College in Sonora, California. He lives in Sonora with his wife, Sarah Gorchoff, a psychology professor, and their children, Betsy and Benji. Thanks for being here, Daniel.
Thank you. Thanks for having me. I really appreciate the invite. So I want to share the story of my now 7-year-old daughter, Betsy. So at the time she was 6 years old in February of 2024, we started seeing a lot of the kinds of things that I'm sure this community is aware of. Symptoms like isolated vomiting, extreme lethargy, clumsiness, lack of balance, falling, pretty acute behavioral swings. The kinds of things that are definite symptoms in hindsight, but are really difficult to parse out from just a normal 6-year-old's behavior, right? Two of those symptoms in particular, though, were really kind of alarming for us. She was having a lot of headaches, but I remember thinking it was very odd. She wouldn't say she had a headache. She said that her forehead hurt. And then probably the most concerning was that her right eye very suddenly and very visibly started to point inward toward her nose. At this point, I didn't think much of it. I just thought I wear corrective lenses, so I thought maybe she just needs glasses. My wife got very concerned, took her to her pediatrician in Sacramento, which, by the way, we're living in Sonora now, but we had moved to Sonora, California for my job at the college here right after I had finished living in Sacramento to finish my doctorate at UC Davis. And we had yet to switch to a local doctor. Sacramento is the largest city close to us, and it's about 2 hours away. Very, very thankfully, her pediatrician was extremely concerned, and my daughter went to an emergency room for a CAT scan. That didn't look good, and then my daughter was taken to the Bay Area for an MRI, and then was in surgery the very next day to remove a plum-sized tumor from her right frontal lobe. We were super duper frightened, that she would wake up without any of her faculties, memories, etc. But the surgical team did a wonderful job letting us know that the only possible real complication, we had no idea how they knew this, the only possible real complication that they envisioned was her left side would be immobile, which it was. So very soon after recovering from surgery, she started physical therapy, and very thankfully with all of her witty, funny, and very strong personality traits intact. And I should point out here that we were very, very lucky and privileged. My wife's family, a lot of them are in the medical field. My father-in-law is a doctor, a general practice doctor and researcher. My mother-in-law is a retired midwife. My sister-in-law is a practicing pediatric nurse practitioner. My sister-in-law, especially, she took off work. She took a leave of absence from work to help us navigate this thing. As you mentioned, I'm a professor. I have a PhD. My wife is a professor and has a PhD. Even with all of this and all of my wife's family, no one seemed to know what was going on. And we often felt that our questions or concerns were going unaddressed. Look, I get it. I've been around hospitals a lot now, and I know that they're just like anything else. Communication can be very difficult. One funny side story is that when morning rounds were happening, I would introduce myself as Dr. Godsill. Even though my PhD is in music composition, I definitely got some strange looks for that. But I wanted to just be communicated to as an intelligent person, and I wasn't seeming to get it. But in any case, I also understood that pathology would take a while. But in our case, it seemed to take a very long while. It was almost 3.5 to 4 weeks. It really, really felt like an eternity while my daughter was in physical therapy, making great strides. When we finally got the call that it was ependymoma, you would all probably laugh at how I tried to spell ependymoma when I was taking notes. But very soon after we got this diagnosis, we found out that my daughter needed another smaller surgery. And it was about 3 or 4 days before someone really told us that these kinds of second pass surgeries are actually quite common. This was probably the most frightening time for us. We thought that this tumor was already growing back. But in any case, it was eventually communicated to us. The pathology report indicated that my daughter's tumor was indeed grade 3 and that it was YAP1 and RELA positive, and that radiation was recommended. None of this I understood. My sister-in-law, fortunately, became kind of an amateur expert in ependymoma. She did a lot of work, a lot of research. And she also, through her connections in the medical field, was able to get in touch with various oncologists to, again, help us navigate this. The radiation team was very, very good, communicating to us very clearly the procedures, the possible complications from radiation. We felt very comfortable with that. Right around this time, too, I was speaking with my daughter's oncologist, and it was sort of slipped into the conversation, because this tumor is grade 3, because it's summer, we can put a port in and start chemotherapy. And, it's summer, it's pool season, you could still be going swimming with this port. That wasn't exactly, what I wanted to hear, but that didn't sound that bad. A few days later, I was speaking with another oncologist during one of my daughter's MRIs. They had seen the prescribed chemo regimen, and they told me, you're not going to any pools. In fact, for the duration of this regimen, you're going to have to move within quick driving distance of a hospital that knows how to deal with the inevitable complications that are going to arise from this. At this point, we had not lived at home for almost 3 months. In any case, we started to do even more digging around. We found especially encouraging some resources that we found through CERN. One video, I'm not entirely sure where I saw this, but it was a video with Dr. Nicholas Foreman mentioning that it's a priority of his, for instance, to keep a patient's fertility intact in case they want to start a family on their own someday. And I found this so hopeful and encouraging. And I started to feel as though the advice from her care team was getting kind of emotionally manipulative. Like, we have this tool of chemo, and we're going to use it, sort of damn the consequences. And the consequences are even positive outcomes of this treatment. Didn't even really seem clear to any of us at this point. And I have to say, our second opinion was not super official. It was maybe not done through official channels, I suppose, but frankly, we didn't care. The whole second opinion thing was rather confusing, which is one of the reasons why I really enjoy having CERN as a resource. And we really felt that time was of the essence. There were certainly some ruffled feathers, but I felt, say in my line of work, if I ruffle feathers by writing research about Beethoven's late string quartets or something, who cares? But for this is my daughter's life. So I'm happy to report that we're almost a year out of my daughter's radiation treatments, and she is absolutely thriving. She just finished first grade with flying colors. We've moved to a new care team at UCSF, and it's been really wonderful. She has MRIs every 3 months, and the next one's June 30th. So I always try to just put it out in the universe. My daughter is a very bright light in this world, so let's keep her around a little while. I want to close by saying personally, and forgive me, I'm a Northern California hippie, and I go to a holistic doctor and I take a battery of supplements, and I'm very careful and mindful about what I and my family eat. Um, I would love to get more guidance about nutritional and supplemental best practices for my daughter. And again, I'm a realist, I'm a scholar myself. I understand that this kind of research may not be cutting edge or sexy or get the best grants, but I can definitely tell you after having observed ependymoma and cancer groups online, there's a huge want and need for this kind of thing. Um, Sometimes I find when I bring these kinds of things up, uh, the, about nutrition or supplements, my questions are dismissed very quickly. Like there's not research on that, so let's not go down that route. Um, I personally think that myself and many others don't just want that kind of treatment immediately off the table, along with all of the more cutting edge treatments. So um, anyway, thank you all so much for letting me tell my story.
Thank you, Daniel, so much. And thank you for just sharing your honest experience and sharing your daughter with all of us. And we're just cheering her on and rooting for you guys in every possible way. So thank you for being here. And I know your story will resonate with many people. And we echo your cry for, of course, cutting edge research, but also the whole holistic approach to care as well. We need all of it. Um, Now I would like to introduce you to our second expert speaker, Dr. Mariella Philbin, who will talk about the importance of tumor testing for ependymoma. Dr. Philbin is a pediatric neuro-oncologist and principal investigator at Dana-Farber Cancer Institute and Boston Children's Hospital. She is an assistant professor in pediatrics at Harvard Medical School. In addition to her role in the treatment of patients with brain tumors, her research focuses on establishing cellular networks of tumor dependencies in pediatric brain tumors with the goal of finding new targeted therapies. Please join me in welcoming Dr. Philbin.
Hello, Kim. Hello, everyone. It's really a big pleasure for me to be here today. And thank you again, Daniel, for sharing your story about your daughter, and also Mike and Megan. That's why we're here. That's the most important thing we want to talk about today, is how these stories like yours resonate with all of us and how we can use this energy to push the field forward. And Kim had asked me to give a little bit of background about the research and molecular classification of biomarkers and how that will hopefully guide us, or is about to guide us, in our treatment decisions going forward. So if you want to talk about progress, you always have to start in the past. So let me start with 1924, a long time ago. That's when ependymoma was first described by Professor Bailey. And so 100 years later now, you would think that there has been a lot of progress, which there has been, but not really until the last 10 to 15 years. So for about 80 years of knowing this diagnosis, there hasn't been a lot of progress. Why? Multiple reasons: neurosurgical, progress that needed to be made, pathology progress that needed to be made, oncology progress that needed to be made. But for the longest time, we really used to diagnose ependymoma under the microscope by seeing ependymal rosettes. This is what in 1924 Dr. Bailey had seen. And then classifying ependymomas by where they were from in the brain and spine. So either in the upper part of the brain, called supratentorial, in the lower part of the brain, called infratentorial, or in the spinal cord. And that was about the case everywhere around the world until about 10 to 15 years ago, when the first few groups started finding the drivers, or the first of many drivers known to underlie ependymoma. And these few groups found something that's called a fusion. That's a complicated DNA event, something in the nucleus of those cells. And it was dramatic in the way it changed the field, because for the first time, we kind of knew what was driving some ependymomas, but not all. We still had about 3/4 of ependymoma cases where these fusions were not found. And it wasn't until about 10 years ago when this new test came into the field more, which is called methylation classification, which is a technology now more and more used in many centers around the world, that allows us to classify ependymomas more and more. And you could say, well, what is that? Is that useful? Do we really need to know that? And my answer to that is yes, absolutely. Even though we might not know all the answers to all the questions we have, But classification and giving the tumors a name is the first step in understanding where they come from, what they need to thrive, and how we can block that for our best treatments going forward. So methylation classification, in addition to all the testing that we've already heard about, is really now, I would say, the standard of care, and also as such is described in the WHO classification. And who does that, or who should talk to you about that? Like we've also heard before, you need a quarterback. Ependymoma in your team, I mean. Ependymoma is a very long journey, as many of you know, and it always needs different kinds of doctors helping you. A neurosurgeon, a radiation oncologist, an oncologist, neurologists, pathologists, all these doctors. And in the most ideal case, they should all work together in what we call multidisciplinary tumor board, which we had heard about earlier. Because in those tumor boards, what happens is that doctors meet, talk about all the patients they have seen in the prior week, and discuss all these different aspects. They discuss about the surgery. Was it enough? Do we need to go back and do a second look surgery that we've talked about? And again, what is the diagnosis on the methylation side? What are the biomarkers, the most precise biomarkers that let us give this ependymoma, the specific in this patient's ependymoma, a name? And oftentimes in our case in Boston, but in many places around the nation and the world, it's the neuro-oncologist who then summarizes all this information that is discussed at tumor board with the patient, a primary oncologist ideally, but sometimes can also be the neurosurgeon who is your quarterback in that sense. Coming back to the importance, why is it important? We currently use the methylation classification or the methylation subclassification as a marker for diagnosis, and we're starting to use it for prognosis. Sometimes or oftentimes I get asked by my patients, Dr. Philby, now you gave me all these complicated words, but what does it really mean? And unfortunately, oftentimes I have to say, we don't know yet, but we still need to know, because the more patients we see with that particular name or that particular fusion, the more we can find what's similar among those patients. And then the more we learn as a community, the more we can design clinical trials specific to a particular tumor subtype, and then move the field forward together. So while right now these complicated names and subclasses with all fancy names don't have a particular treatment linked to them quite yet, we're really starting to do just that. And there's a lot of clinical trial consortia around the world, especially for pediatrics, but I also know for adults that are now starting to take that into account, looking at exactly the subtype. And in order to enroll onto such a clinical trial, you will have to know. So again, even though the importance right now is diagnosis and prognosis more than anything, in the future, it will be clinical trials based on that name of your tumor. And just to give you two examples and also go a little bit into what Daniel had just mentioned, Zephyr-Relay tumors are a subtype of supratentorial ependymomas. So that's a mouthful. Just to say that it's an ependymoma in the upper part of your brain, supratentorial, and it's driven by fusions called Zephyr-Relay. These fusions were first diagnosed 10 years ago or first found 10 years ago, but the Zephyr part has just been described in 2021. Just to give you an idea how quickly this field is moving, even though I'm aware that for a patient, for a family, it couldn't move fast enough. And like why this hasn't led to treatments quite yet is a good question that I always get asked, but we're working on it. And in particular for this subgroup that was just described 3 years ago, there's a lot of worldwide collaborations that are going on that many of us on this call probably are also part of, where we share patient samples so that we have this good number of patients with the same exact diagnosis that we can then look in further detail. And then again, looking at what drives these tumors and how can we start to treat. And some of these papers will be coming out soon, later this year probably, or maybe early next year, and will hopefully form the basis for our next clinical trials. And just coming back to what Daniel said as a last closing remark, diet and different ways of treating, in addition to what we thought of conventional chemotherapy is, which is toxic, is also becoming a big part, especially of the ependymoma community of research, at least for now, because we are learning and starting to understand that some ependymomas are driven by different metabolites. That means something in either your diet or in the part of the brain where the tumor grows is particularly different in certain tumor subtypes, and then we can revert that therapeutically. So far, not quite in clinical trials, but it's really important that you tell your doctor about what supplements you're taking, what other things you're doing. Because again, we are starting to understand that metabolism has a huge impact and importance in ependymoma. So the more we share and the more we learn together, the faster we will move the field. So just rounding up, thank you again, everyone, for being here today, for sharing your stories, for coming. We will only move the field forward if we work together. And it's really, really wonderful to see you all here. So thank you very much, and I'll be in the chat to answer any questions that might come. Thank you.
Thank you, Dr. Philbin, for that excellent information. You did such a great job of summarizing a very complicated topic. And we know that this evolving science is challenging to keep up with for some providers and for also the patient community. But I feel like you presented the areas that we need to be aware of today, and then our understanding of how that impacts the future. So thank you for that. So at this time, we're going to have a second optional poll. And we want to capture the diverse nature of ependymoma. And so we have summarized the groups into this system, but if you identify with a diagnosis that's not listed here, you can select I do not know or other, because I know that information can be presented in different ways, but this was the most concise. So do you know your or your loved one's ependymoma subgroup? We'll give you about a minute to respond, and then make sure to hit submit. Thank you, Robert. So this is interesting information we've got. Looks like the majority of folks are the supratentorial ependymoma ZFTA Raleigh fusion with 26%. But as you can see, we have quite a few PFA, spinal ependymoma, as well. And so I think this is so important to capture how diverse this disease is. There are some tumor types that have 4 subtypes, and those 4 are really clean cut and they fit in certain parameters, whereas ependymoma really can get, we can start getting into subgroups. So it's interesting to not only be aware of, but also it brings a lot of awareness to why it's difficult to research. We just have a few numbers to begin with, and then when you start cutting it into 10 and further different groups, it can be challenging, but we are aware of that challenge, and we're trying to overcome that with various research strategies. So thank you for your participation. It's clear that we've come a long way, but we also need a lot more information to get personalized treatments. And again, the results from these polls will be shared after, just so that we can bring that to folks that weren't able to be on the call. At this time, we're going to share a moving video featuring 20-year-old survivor Emily Meyer as she tells us about her diagnosis, challenging surgery, long recovery, and road ahead to accepting her new normal as an ependymoma survivor. In the past, National Brain Tumor Society, we have hosted an in-person event that often had a live butterfly release. And so as we're moving to this more international virtual Ependymoma Awareness Day, we wanted to keep that element of the butterfly release included. And so we did that recording Emily releasing the butterflies as she was a part of Head to the Hill this May. So Robert, please share the video with the folks.
My name is Emily Meyer, and I was diagnosed with an ependymoma. It was from my brainstem all the way down to a T5, but my scar goes down to T7. And I was diagnosed with an ependymoma on June 21st of 2023. It was a shocker. I didn't know anything about it. No tumors have ever been in my family. The reason why I got checked was because my balance was so bad. Slowly, over the course of like 2 weeks, just couldn't walk. I was not stable and I was extremely weak. I couldn't raise my arms above my head. And I went to the beach with my mom and I could barely make it back up to the car. And so my mom was like, you have to go to the ER. And we were going in for my leg. And then they did an MRI, but it lasted about an hour. And then I went back to the room with my parents and they told me I had a tumor. I went to Porter in Valpo and they were like, we have to transfer you to somewhere different. You can either go to Indy or you can go to Chicago. We chose Chicago Northwestern. I stayed there for 3 days getting more MRIs, CT scans, everything. They still didn't know what it was. They knew it was a tumor. They were like, this is the biggest one we've ever seen. I was like, oh, that's not something you want to hear. But I still wasn't nervous or anything. I think I scared everyone else because of how calmly I was reacting. I met with my spinal surgeon and my neurosurgeon. They kind of gave me the base plan of what they wanted to do. And originally, because of how big it was, they thought that they were gonna have to do 2 surgeries. It ended up being only 1 surgery, and it lasted about 19 hours, I think. It was really long. When I woke up, I was intubated. I was basically paralyzed from the waist down. That lasted for over a month. I relearned to walk, to move my arms, to brush my teeth. Literally every basic thing you would think that's easy became extremely difficult for me. My surgeons were incredibly impressed with how quickly I recovered. Because an ependymoma is a pediatric tumor, they were like, you should have noticed this way earlier. But I was 18 and I'm 20 now. I'll be 2 years tumor-free in July. Symptoms didn't start appearing until like 2 weeks before I went, but my weakness and my stability completely vanished over the 2 weeks right before my diagnosis. That's why they were so confused at how long I went without noticing it. But so far, all of my scans have been clear. So surgery was the only thing I had to do. I did look it up once they told me what it was, but there's not much out there. It's just a unique experience having to do this kind of blindly, not really knowing. I love the community that it's around. Everyone is so kind and they understand on a different level because they've been through it. It's changed my life in a lot of ways. It's severed my independence a lot. With the symptoms I'm left with now after surgery, there's so much I can do, but there's also things I can't do. I haven't been able to go to college yet because I have no sensation in my hands or my arms. I have dexterity issues and I can't look down for long periods of time. I can't really cook for myself. That's changed my life in a lot of ways, where I used to be so independent with cooking or even doing my hair with hot tools. Thankfully, I have a very good support group and they have supported me through the whole thing, helping me laugh through it all. I never had a moment where I felt like they would leave because of it. So I was really grateful just to have friends that understand me. I would say to someone that's newly diagnosed that it's okay to go through every emotion. I know for me, I felt like I had to put on a brave face for my family specifically, but I think also allowing yourself those moments to be mad about your diagnosis too was really helpful for me, because I was like, this sucks and I shouldn't have to go through this. And telling myself that made a difference in okay, I can get through it though. I'm mad about it, but I can adapt. Raising awareness is really important to me because of the lack of information we have, and getting more people to understand how important it is the key to everything. I tell my friends and my family that sometimes it doesn't even feel like it happened. So it's hard to wrap my head around the fact that I did go through such a traumatic thing. Life can really change within an instant. I was just a regular teen living life, and that all changed within 2 weeks. And I think just not taking life for granted. I think the butterflies are a perfect representation of hope and just growth and change. It's the perfect way to just symbolize how strong someone can be. I just want to keep living life as bright as I can.
Thank you, Emily. And feel free to, I know Emily and her family are online, so feel free to encourage her in the chat, but just you are a light to the world and you are just amazing. I got to spend time with Emily and just what she's overcome is truly remarkable. Just like all of you, I know that resonates to just being in those moments where you don't know how you're going to get out, but you do. There are so many of you, as Emily mentioned, about community and the importance of just being with people that understand. It's just essential in this experience. There are so many of you that dedicate a lot of time and attention to supporting others, in addition to caring for yourself or your loved one. Because of this, we wanted to create a new award to recognize such outstanding people. So new this year is the creation of a community award. This award is determined by our staff and is determined based on service, kindness, and endurance in the Ependymoma community. And as Dr. Philbin mentioned, this is a long, often many of us are in this for many years, and it is exhausting. And so to be able to show up and to keep supporting is truly remarkable. So I would like to present this award to Rich Delato and Alex Brooks on behalf of the entire Childhood Brain Cancer Research Collaborative. I'd like to give a huge shout out to Buffalo, New York community that continues to show up and support their event year after year. Rich got involved because he is a father of a ependymoma survivor, and Alex is just a true leader and adopted this cause as his own. In addition, for preparing for their 7th annual golf outing, Rich and Alex recognized the importance of supporting education for families and sponsored the update of the Ependymoma Guide last year. They also recognized the ongoing need for critical research commitment over year after year and took action to help MBTS fuel translational discovery for pediatric ependymoma by contributing proceeds from their event to the Ependymoma Fund, which supports Dr. Stephen Mack at St. Jude Children's Research Hospital. Thank you, Rich, Alex, Kara, and the entire CBCRC team for your unwavering dedication to this cause. Truly appreciate it. And thanks again to everyone who participated in today's awareness efforts. Because of your support and dedication to the National Brain Tumor Society, we've been able to provide education resources, personalized support and navigation, and support these 3 key research initiatives for the ependymoma community. And highlighted here are the actively funded projects that we have at MBTS that are a direct result of your commitment and contributions. These efforts are connected to MBTS's overall research strategy, which is to accelerate development of new treatments and improve the lives of brain and spine tumor patients. Thank you, Doctors Mack, Goyo, and Sheikh, and all of your team members who some of are on the call today. Thank you truly for what you do every day to try to make new discoveries, to navigate challenges and answers that aren't coming fast enough, and identify possible treatments for this disease. After Ependymoma Awareness Day is concluded, you will receive a follow-up email with lots of ways to get involved. There will be a recording of this webinar along with highlights from the day, the tips from the experts and the families, and also the poll results. We want to make sure you're also aware of the robust advocacy program at National Brain Tumor Society that you can sign up to join if you're interested in that. Now more than ever, we need to continue to advocate for federal funding for brain tumor research. Included in the follow-up email will be a link that will be for U.S. participants to join our advocacy alert efforts. And then you're welcome to come with us next May as we go to Capitol Hill all together in a group of 300 plus advocates, brain tumor wide. While we know there's a lot more work to be done, and I know more information is needed, we do hope that today was meaningful and informative for you in some way. Please email us if you would like to connect specifically on something or have a need for additional support. We encourage you to get involved by raising awareness in your community today on social media or just sharing with a neighbor. You can make a gift in honor or memory of a loved one, or do something special today that's meaningful for you and however you choose to recognize this day. I realize it holds a lot of different meanings for different people and depending on where you're at. Thank you truly for tuning in, and we will conclude by remembering Ependymoma survivor Maisie's words. Hope stands for holding on for possibilities that are extraordinary. Thank you so much.
Thank you.